Yeah, so at this meeting, I'm presenting the results of our phase 1b study called SAVE, which stands for Safe Accelerated Venetoclax Escalation for patients with chronic lymphocytic leukemia. We know that venetoclax is a very active therapy for patients with CLL, and it's approved in both the frontline and relapsed refractory setting. However, it is difficult to use for many patients because of the cumbersome 5-week dose escalation ramp up that's required to mitigate the risk of tumor lysis syndrome, which is a known side effect of venetoclax. So in this investigator-sponsored study, we aimed to evaluate whether we could safely escalate patients with CLL starting venetoclax on a more accelerated timeline with daily dose increases. So this was done in the inpatient setting, and patients received an increased dose of venetoclax each day. With close monitoring of tumor lysis syndrome labs. We also started with patients who were low risk for tumor lysis syndrome, and if it was seen to be safe in that cohort, we expanded the study to include patients with medium to high risk tumor lysis syndrome. And so we had 40 patients enroll in this study, 25 from cohort A, which was the low risk cohort, and the remainder from the medium to high risk cohort. And we saw that this method was safe. We had only one patient who was high risk for tumor lysis syndrome develop laboratory TLS, and no patients experienced clinical tumor lysis syndrome. And that patient who did have laboratory tumor lysis syndrome received therapy and improved within 2 days with an extension of their inpatient stay only for a brief period of time. Of note, CD20 antibody use was per the discretion of the treating provider, and the majority of the patients in our study did receive a CD20 antibody prior to venetoclax treatment, which may have helped debulk many of these patients. So overall, we think this is a strategy that can be helpful for many patients and physicians, and something to be considered if the appropriate monitoring is in place.